Welcome back.
Welcome back. Today we are talking about the treatments that I have done.
Why?
Because it's still a question that I get asked very often.
Mm-hmm.
So, to start with, I have been on Faslodex, which is also called fulvestrant, since 2004. That's my current treatment. I go once every 4 to 5 to 6 weeks. And it's an injection. I get that, every time that I go. We did reduce the dose.
What is it? I don't know this.
You don't know?
I don't even know what it does.
It blocks estrogen. It blocks estrogen.
Okay.
I don't have any estrogen. I don't know. It blocks receptors, so it can't. So it would
Estrogen
be like,
receptors on
allowed.
white blood cells, probably.
Sure.
I'm
I should
guessing.
probably
I don't
know. This is where you guys are all going to be yelling at me like, how do you not know all this stuff? I don't know. It's worked well for me. We did reduce the dose. I've been on Faslodex for so long that in 2004 it was just kind of coming out, and it was 250 milligrams or whatever, one shot. And then as they finished all of their trials or research or whatever, they made it 2 shots. And honestly, just over time, I have a lot of scar tissue in my hip area because those are big needles. I'm not one to complain about the shot itself. It's super easy for me to tolerate, all of that kind of stuff. But the buildup of the scar tissue over time has become kind of cumbersome. And it was getting to the point where when I had to do an injection on both sides, I was feeling it more than I had. So we went back to 250 milligrams to 1 shot, and now I can alternate, and that just works a lot better. And I had no problem from a mental standpoint because honestly, that's what it was in the beginning when it started for me, and just I don't know how all of that comes about in terms of trials and research and pharmaceuticals, but sometimes I do feel like they kind of go more is better. And I don't know if that's necessarily the case.
Or there was 2 trials happening at the same time. One was 250,
maybe.
One was 500, and the results of the 500 were a little more optimistic.
Right.
Something like that.
Who knows? But yeah, so that has been my treatment for a long, long time. But let's go back before that, because I was diagnosed in December of 1998. I started chemo with stage 4 breast cancer. I had a 5 or 6 centimeter tumor in my left breast, and innumerable bone mets. So I know they were everywhere. I have never gotten into details on that. I do know that they were like spine, all over different pelvis, sternum. I actually felt it in my sternum. But that's not something that I've really wanted to know specifically because it messes with my brain in terms of how I perceive pain and all of that kind of stuff.
You get a general idea of where they are because when you go into your oncologist, they're saying, how does that feel? How does that feel? Any pain here? Any pain here?
Yeah.
I mean, they're not just picking spots.
No, they're not picking spots. And we'll talk about some of that as we go on, too. So, but as soon as I met my oncologist, she had already been thinking about the plan over the weekend. We talked on a Friday, started on a Monday. And it was a little unusual at that time, but to not do surgery right away. Mm-hmm. But we started with chemotherapy. We're going to do 4 rounds of chemo, and it was adriamycin and Taxotere. So
it was just 2.
2 of them, yeah. 2 medicines at the beginning. And they probably...
took a long time.
It did.
Seems like we were there for 8 to 10 hours a time.
I don't think we were there that long.
Okay.
No.
Right.
Maybe on a day, there might have been some days that were a little bit longer. I don't know how quickly we introduced the Zometa, which is a bone strengthener. I feel like that was a little bit later, though.
I do too.
So no.
In my head, it was more than two things. I remember one was a push.
Yep, that's adriamycin.
And the other was a drip. Mm-hmm. Maybe the drip was just for a long... Could it possibly have been for 4 hours?
Yeah.
Oh, okay. All right.
It could have been. I don't remember how long it was. And definitely, I mean, those of you who've done chemotherapy, you know that, like, if things don't go well, they slow it down or they stop it. And sometimes you have to kind of add pre-meds and steroids and things like that so that you can handle it. So,
okay.
So we did more testing at the after my third treatment. We did kind of rescanned and started to look at how things were going. My tumor was undetectable at that time already. It was like it was awesome. And then we started preparing for the next part of my treatment, which again, big asterisk, this was 1999. And I actually enrolled in a clinical trial for a double stem cell transplant. So the process with that was that they were checking to make sure there was no cancer in my bone marrow biopsy, by doing the biopsy. And then we were proceeding with a stem cell transplant. And the whole idea behind that is that you would kind of wipe out everything and then reintroduce your stem cells to grow and kind of create a new environment that's cancer-free, I guess. I went into the hospital on March 17th, I remember. St. Patrick's Day was the day I was admitted to the hospital. And we did 96 hours of continuous chemo. And I can't tell you what they were. I know there was more of the T family. I believe Taxol was in there. I don't know. Probably 3 or 4 different drugs we were doing. I felt great through the first couple days of it. Mm-hmm. And then all of a sudden, I remember actually, we had family that lives in Ann Arbor, which is where I was for the transplant. I was admitted at the hospital. But they had brought me dinner, and I remember, like, all of a sudden it just turned, and I threw it up, and I then didn't eat for quite a while.
And it makes sense that it followed your counts. I mean, your white blood cell count was getting close to 0 at that point.
Yeah.
And your body just doesn't want to function normally.
Right.
It's a trade-off, obviously, and obviously, overall, for all of the patients who got this double stem cell, it didn't go well.
Right.
So I think you were one of the unusual ones that did go well for, I guess.
Well, and I mean, I guess the question is, like, go well in what respect? We were already, like, the cancer, it seems like we had a pretty good hold on the cancer, at least on the tumor itself, before we started this stem cell transplant. So I was inpatient for 3 weeks at that time, and it really was horrible. There are days that I don't remember. I remember getting pneumonia or finding out I had pneumonia at one point and being so upset and just like, is this what is going to kill me after all of these things? Just like terrible throat sores.
All of the things that you guys know if you've done chemotherapy, all of those side effects amplified by a factor of I don't know.
Yeah.
So everything that you think of that was just really, really amplified, and it was scary. I mean,
yeah, and like your white blood counts normally are like 4,000 to 10,000. Like mine got to 7.
Yeah.
Like the goal was to bottom everything
undetectable.
Out. Yeah, bottom it all out. So, and then when it did bottom out, they then gave me back my stem cells, which we had harvested prior to this. And that was also kind of, I remember thinking, oh, this is going to be a big deal. But it was pretty anticlimactic. It was a little bag of them. But yeah, they did it twice. And I remember the preservative, there's something in it that makes you cough. So I coughed my way through getting my stem cells back. And then you had to wait and hope that they're going to take hold and wait for them to get going. So it was a long process. I I was pushing to get out, and I did get out for a couple days and landed myself back in really quickly just because I couldn't stay with like the hydration and things like that. So, yeah, we had a great. Was that when I threw up all the Gatorade all over you? Yeah, that was. I knew he's in for the long haul when I literally puked all over him on the stairs at my mom's house. Ugh, it's terrible. Yeah. So after that stem cell, it was just kind of recover, get better, get stronger. And then the double part of the transplant was that we did the same process again with different drugs, not as many of them. And it was outpatient every day. So I had a PICC line. I had a PICC line both times, I believe, for that. But I would go to the hospital every day, get all my treatment, and then I had to be somewhere close enough. So we stayed at my mom's house because at the time she was living close enough that we had to be kind of within an hour. But it was the same process. Mm-hmm. And after all of that, that took us up kind of through the spring, the whole spring, probably through May. And then I feel like I had some time off then to rest and recover. And I had a double mastectomy on July, either 5th or 6th, I remember. I remember having a pretty kind of just a low-key but nice, normal sort of 4th of July. And I feel like we were on a boat somewhere, and I think that's the name of a song.
I don't remember that.
But then going in for the double mastectomy.
So do you remember that conversation? Because I don't remember that conversation at all. And I now know, 26 years later or whatever, a lot of the negative side effects of the mastectomy, both just changing your body, and from the sensual part of your body being a sex organ. Was there any discussion about that back then?
There was never a discussion. There was a discussion about a mastectomy versus a double mastectomy, but there was never any discussion about not removing the first one, right?
So was the talk, we don't want to give it a place to come back to?
No.
Okay.
The talk was more, we don't want a second recurrence. Like it would probably be a different occurrence if it came back. So I guess in that respect, that's sort of saying the same thing. The other thing was just like kind of the whole, you're going to have one breast and what are you going to do on the other side? Like, how's this going to come together? I was pretty quick to just be like, no, I'm just going to be flat. This is a tough thing now because like you said, I know it has changed a lot. And I literally talk to women who are metastatic who are like, I just want it off. I just want them gone. And I have a friend who just did a double mastectomy and not a stage 4 very early on. And I'm really conflicted. I did not realize how much my breast mattered to me. And
that's why you're conflicted. You were not conflicted.
I wasn't conflicted then.
So I just want everybody to understand that.
No, I wasn't conflicted at all then. And honestly, my only thing at that time was, do I want to do reconstruction? Reconstruction, I feel like maybe has gotten better, but it's painful. And that again was like to me, nope, I do not want to waste time, energy, anything, trying to heal from a reconstruction when I can just just have it gone.
Also knowing that radiation was close in your future.
Yeah, and then I knew radiation was coming. Yeah, so like this was kind of we're going to do this double mastectomy and then radiation and then, reassess where we were at that point. So it was everything. It was a million things. Like I knew I'd have a 10-pound weight restriction with the double mastectomy. Well, if you do reconstruction on top of that, and Sydney was, she wasn't 2 yet, and she was more than 10 pounds and all of that. It was important to me to just kind of get on with it. But I had no idea how much I would miss my breasts.
But at the time, we were still in fight for your life mode.
You're right. In that respect, it
versus
was
enjoy life mode.
Oh, sure.
It truly was. I mean, and that's a separation where you people that have been through this, you understand the difference. But I don't think regular people do.
I would agree with that. I think the other thing that makes me mad now is this is where we're still here in terms of this is the best we've got is we're taking women's breasts off. Even as a precaution, that's a big deal. It's a big deal. And that's where I kind of, not to get off topic with this, but I just kind of go, women's healthcare is so far behind. And I feel like it's behind men's healthcare too, all of this kind of stuff. I feel like, just because we can recreate the illusion of a breast, and it feels like, so people, and there's so many jokes out there, people make so much light of it, and, oh, you got a free boob job, and blah, 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 all this stuff, and it's no, I lost my breasts. I lost the feeling. I told you right after, I don't want you to touch them. Don't touch it. It doesn't feel good anymore. And it used to feel great. It used to be something that could help me be in the mood, all of that kind of stuff. And it was there, it's gone.
Yeah.
And I'm supposed to just be grateful, one, that I'm alive, which I am, but also two, that, but I have I have options.
We haven't got there yet.
That's true.
We're not there yet.
Flat. So yes. I was flat. I do remember waking up from the surgery. I spent one night in the hospital after my double mastectomy. I remember looking down and just going, I guess it looks okay. It kind of just looks like a young boy's chest to me, sort of thing. I mean, with no, obviously, nipples or anything like that, but it just was flat and tight, and I didn't have any kind of compression or anything on it. I did have drains.
Yeah, there was just two pads.
Yeah.
Post-surgery pads.
Gauze type of pads, yeah.
And drains.
Yeah. So, drains are not my friend. I didn't like the drains. They were terrible.
Unnecessary evil in that surgery.
Yeah, I was really happy that you were able to handle that so well. And it just, I had done a lot. I'd been giving myself shots along the way, different things like that. I'm healthcare person, but they just grossed me out. I didn't want to look at them. I didn't want, and it's also having something extra hanging out of your body is just yucky.
Anytime you want to go somewhere, you have these bags.
Yeah.
Did you have 4 drains?
I think I had 4 drains initially.
That's what I remember too.
3.
So there was 4
I think I
bags.
had 3 actually, because they did lymph nodes on one side and they didn't on the other.
That's what it is. Yep.
So, so all of my lymph nodes were also taken on my left side. So yeah. So after that, the recovery from that really went really well. I mean, it was pretty fast and easy. And that took us kind of up until August. Then I was ready to start radiation. The other thing for our lives was you were coaching. Yeah. So I was going to start radiation in a town an hour and a half from our house. So that's 3-hour drive every day. And he's going back to work as a football coach.
Well, a teacher, football coach.
And a teacher, yes. And I was really pushing to try to get things started, and things didn't get started very quickly. And I don't have anything good to say about radiation. It was not a great experience for me. I didn't like the way they treated me at the beginning. When I first went in there, they drew all over my chest and made fun of, were trying to make light of it, like it was a masterpiece, and just make sure it's still there when you come back tomorrow. And then we got into a big to-do about, they were, tattoos for markers, and I was literally fighting with them about how big they would be, and they won't be that big, about the size of a pencil eraser, blah, blah. And I was like, no, how big will they be? And how few do you need? You're not just gonna freaking tattoo me. And like, it's no big deal. This is my body. It's a big deal, you know? So I just went, we just went head to head. It felt like all the time about things. And in the middle of that, I ended up getting shingles, which happens when your immune system is beat up. You know, the problem with the shingles was that it happened. We noticed it at radiation on a Friday afternoon. It was on my face. If you know anything about shingles, it follows the dermatomes. So, you know, which is like rings kind of around your body, but in your face, it's half and half. So it was on the, I don't remember, left side of my face.
I think so.
Yeah, I can still feel, it's still a little wonky here. So left side of my face, but they were concerned it was in my eye, like the way it was. So I got like sent to the hospital farther down the road, which is my hospital that we go to, and admitted for the weekend.
It's very serious. If you guys know, shingles in your eyes can cause blindness. Just had a friend who had a spouse going through this right now. It is very, very serious.
Yeah. To me, it just felt like another huge setback, and
so the whole, you know, when you're getting up to, you know, almost a year of treatment here, and things have gone well, it was kind of like, okay, this is the final thing.
Yeah.
The whole buying in that we've talked to about your treatment, about your doctor, about what they're saying, about everything you're doing, and truly getting your brain behind that, that probably didn't happen with radiation like it did happen with the rest of your treatments.
And I will say also part of that was the radiation oncologist that I met with in Ann Arbor, which is where I still do all of my, I really liked. It just did not make sense to drive an extra 2 hours a day to be at that department. So we transferred up the road to a different town, and I just I didn't have the same confidence. I didn't have any of it with them.
So when we talk about that, I mean, it's just the truth. I mean, there's no way around it. When you have that buy-in, that mental state of this is killing cancer, this is helping me, I got to believe it does more.
Yeah.
I got to believe that is more true compared to the opposite, and it was. And then put the shingles on top of everything, and the tattoos, and it just kind of snowballed. Yeah.
It did.
So you got through it, but it wasn't a pleasant thing.
No.
Now, we were lucky enough to have people in our lives that drove Heather every day, signed up to do that.
And honestly, at that point in the game, some days, like when I'd wake up, I'd be so weak. Like I needed help sometimes. We were learning, like my blood pressure or my blood sugar or whatever would drop. Like he'd put juice beside the bed before it was like holy shit.
It's a rough ending.
Hopefully Heather can get up and Sydney will be okay through all of it.
Good job, Sid.
Sid also could climb in and out of her crib at that point in the game. The kid, she always talks about how independent she is, and it's like, we're sorry, but also I guess it's a blessing. Right?
And she doesn't remember a thing. So. Yeah.
So after that, so radiation finished up, and then it was like, okay, what's next? And that's also super scary, so scary. But I started at that point on tamoxifen, which is aromatase inhibitor, I believe. Again, you guys, I'm bad at this stuff. But again, it was just to kind of keep things in check. I had already, menopause happened immediately. I never got another period after I was diagnosed in December. Never got another period. All of it took out everything. I still have my ovaries. We never did a surgery or anything, but just medically induced. Started tamoxifen and Zometa at that point, which is a biphosphonate. I do know this for sure. And that's a bone strengthener. So that was kind of my new norm. Like I would go in and get the Zometa, and I took the tamoxifen every day. And then I was just trying to figure out, okay, what's this life look like now? I joined a gym.
It's where we get into this post-treatment.
Yeah.
And we've talked about it a lot before if you've heard those episodes. But post-treatment, the beginning of post-treatment is really hard to redefine. Who am I and what am I doing?
Yeah, and also it feels so scary, too, because, you're so used to relying on treatments to, that treatment will take out a cancer or whatever. And just, I know that's what tamoxifen, we had a rule also to do something, but it just didn't feel like, oh, it's going to do anything in the same way. So I was on tamoxifen for, I think it was about a year and a half, and then a scan showed like a slight progression in one of my bones, one of my ribs on my backside, I believe, and so we switched to Arimidex, and then I was on that for a couple of years, kind of same thing, still on Zometa, still figuring all this out, and then in 2004 we had another like slight progression, and I started on Faslodex. So,
Before that, you want to talk about reconstruction, when that happened?
I don't even know. Reconstruction probably happened around in about 3 years after. I'd have to really look through my charts.
It would be like 02-ish.
I think it was a little after that. Ty was definitely home when I
Okay.
had reconstruction. He came home in August of 02. So it was probably 03, honestly, that I had it. I remember that being a challenge. For those of you that have had reconstruction, I had to have expanders put in. I had a lat flap on my left side, so we pulled the muscle from the back around. It was really painful. I mean, just the expanders are really painful as they add to them. But it was also, prior to that, one of the things that drove my decision was it was really painful to be flat with no anything right here. And I remember a time prior to doing all this that Ty just had kind of rocked his head back and hit me in the chest. And it hurt so bad. You know what I mean? And I'm just thinking, okay, maybe I need something different. Also, clothes weren't fitting that well. Whatever. I just was ready at that point to try a reconstruction. I'm glad that at the time I was very healthy. I felt good. My body was strong, because it's no joke. Like, it's just no joke. I slept many nights in the recliner, and one time we had to go back and have him take stuff out, and like it just was really painful.
Yeah.
Yeah, so I feel like that was a months-long process. I don't know, definitely over a course of a whole spring.
Yeah.
You know.
Yeah.
Yeah. So, the Faslodex came along in 2004, and then in 2008, we had a situation where again scan showed something. And at this point, you guys, I was probably doing still like CAT scans and bone scans. I don't think I was doing PET scans yet. I don't remember when that started. But anyway, I ended up just really pushing for a biopsy on this, because I just didn't, I felt like so my doctor wanted to add Herceptin, which was fine. I didn't have a problem with that, and we ended up adding it, but I still pushed for that biopsy. And when the biopsy came back, it actually wasn't cancer. And that taught me so much about like...
Taught them too.
And it taught them too, yeah. I agree.
I mean, it's a research hospital.
Right. So we did add Herceptin at that point, and I was on it for, I don't know, 5 years probably. And then we quit the Herceptin. I was having some problems with the ejection fraction of for my heart. And it was kind of like, well, wait a second. Did we actually need to add that? Because that biopsy showed that it wasn't really cancerous. So again, just learned a lot in the process of that. And just, trying to figure out how to advocate for myself. Since then, I've literally have been stable, but there has been one other time. I'm trying to think how long ago I had the rib removed.
Yeah.
It was probably 5 years ago. Yeah. So I was having a scan. Again, if I'm going to get pain, generally it's in my back. It's usually on the right side. I was just getting this, it won't go away. I have all these processes about how to work through this kind of stuff, and it just really wouldn't. And then we ended up, there was something on a scan, couldn't tell exactly what it was, and ended up doing a whole rib resection because you couldn't get to it without taking it out. And honestly, that was a great thing. Also, in terms of just feeling okay about things. Like the surgeon that did it was able to just do a little incision and do it robotically. Pulled it
That's
out.
the amazing
This
thing.
was also
so
like
uninvasive.
a last minute decision.
Yeah.
With talking with him, he was like, "Oh, I use robotics for other things. I bet I could." Anyway, it changed the recovery.
Right person, right time, right place.
Yep. And also then the reassurance of knowing that like this is what this really looks like. So so yeah, that's where I mean my over the last 5 years most of my issues have been with my jaw because of ONJ, which is from being on I was on Zometa from 1999 until 2013 and we had tapered it. Nobody's ever on it that long anymore, I don't think. But we had tapered it, but it did cause osteonecrosis of the jaw. And that's been what we've dealt with, I think. Yeah. But, I mean, now we're looking at, like, I'm going back in September to see my oncologist, and I'm fine on Faslodex, but I'm also thinking, like, I don't know. Do I stay? Do I stop? I don't want to invite trouble, but I also am like, I feel now probably more ready than I ever have to maybe just be done. So, craziness.
Yeah.
But, yeah. So,
that's the story.
There's a recap for you, for those of you who really hate to go back and find old episodes of my medical treatment. But, anyway.
And if you have specific questions that she didn't touch on with any of that stuff, ask for sure.
Absolutely.
Yeah.
Yeah. All right. We'll see you next time.
See ya.